Okay, we will get started. Thank you everybody for showing up for safe animal handling and rescue. We will discuss proper techniques for handling animals, whether in the field or on property here at the South Florida Wildlife Center, and include some rescue tips and techniques. If you want to rewatch any of this recording or want to share it with anybody, we will post it on our YouTube channel within the next 24 hours. If you do have any questions, you are free to ask them in the chat at any time. If I see them and I'm able to answer them right away, I will. If not, I will take questions at the end of the class. Okay. Let's see. Okay, so some supplies that you are going to need for safe animal handling. We're going to go over all of these again in each of the slides, but basic supplies for animal handling are gloves. You can either use the latex or nitrile. We ask our volunteers to reserve the nitrile gloves for those who have latex sensitivity. But you'll see them in all of the different areas in our hospital or around the property. There are also welders or gardening gloves, depending on the species you are handling. You'll need different thick protective gloves. We'll go over each one of those with each slide. Depending on the species, you may need eye protection, your regular everyday reading glasses. Vision glasses sometimes are good enough, but sometimes you need full eye protection. We'll go over that. All the different nets that you can use and the appropriate nets to use for each species. Containers, whether they be carriers, kennels, cardboard boxes, or Tupperware bins that have been retrofitted with air holes. We use all of those containers here on the property, and we'll go over some of them. Towels, sheets, pillowcases, newspaper, etc. Different substrates to put on the bottom of all of those carriers and containers, depending on the species. If you are interested in doing rescues or you're helping do shifts and rows in the hospital, always remember that disinfecting all your cases and containers and things like that are important that you do in between of each patient. And as always, throughout all of this, don't ever forget, if you are unsure, always ask staff member. So these are some of the basic supplies that we use here on our property. We have all these exact items. As you see, the large welding gloves, those are best suited for your larger predators, raptors, raccoons, coyotes, adult possums, definitely adult squirrels as well. Below you see the classic gardening gloves. We have a variety of these. Most of you will have them in your own homes. They're great for rescuing wildlife, for very debilitated squirrels, young subadult squirrels, small owls like eastern screech owls, burrowing owls. These are great gloves for those. And then basic, gloves, latex disposable gloves or nitrile gloves. Just know your size, and if you do not have latex sensitivity, we ask that you use the latex gloves. Eye protection, we have eye protection at every one of our stations here. They are clear goggles. They can go over your reading goggle or your reading glasses or just on your face. You can disinfect them with just basic alcohol, rubbing alcohol. We also have two size nets on property. You have the smaller butterfly net, very, very often used for small birds, warblers, things like that. Then you have your larger net used typically for species like the cormorants and hingas, pelicans, raccoons, the larger species. When you are transporting wildlife, whether it is on property or off property for rescue or for release, or even for just weighing your patients, the best practice is always to provide a bedding at the bottom of the container, whether a carrier or a cardboard box, a crate. We want to make sure that our patients have traction. Unlike us, their feet are very smooth, and they often will just slip and slide. On top of that, if they are injured, there might be blood or feces that makes them uncomfortable. So a nice little bedding at the bottom of a carrier or container is always best. We like to cover the bottom. If there is any question, and you want to put something down, we advise putting a sheet down. Everybody can be on a sheet, but some of our patients, like anhingas or woodpeckers, they cannot go on a terry cloth, so like a bath towel, a beach towel. Those are dangerous to those types of animals and can really injure them further. We want to always line the bottom of our carrier container, with a towel, a sheet, newspaper. And then once you've closed the carrier or sealed the box, always with the breathing holes, you want to make sure that the patient can't see you. So as you see in the image below, the carrier is always covered with a towel. This provides a visual barrier between the animal and yourself. This reduces their cortisol level, their stress level, and it definitely helps with just the overall well-being of the animal. Elevated cortisol levels have been proven to slow down the healing and recovery of patients, even in humans. Some important points here, whenever you're handling wildlife, whether you're a staff or volunteer, is to always take your safety first. You can't help wildlife if you aren't injured. So we are making sure that we are always keeping ourselves safe. Ask questions. If you haven't handled this animal or you're particularly new to handling wildlife, make sure you always ask questions. It's better to know more than not enough. So make sure that you ask the staff that is assigned to that section or a skilled volunteer. You can always come to me. I'm for the most part always on property, so you can always come to me and ask me questions. But also be patient with our patients. They sometimes are difficult to catch, or you are having a difficulty holding them appropriately in the correct manner. It's better to be patient, take your time, than to rush it and get injured or injure our patients even more than they already come into us. Observe. It's important to observe all of us working. Observe your patients. See where, if you notice that the animal has a cast on its leg, you should be very gentle with that animal, particularly when you're grabbing it. Observe it. If its head is down, you might need to support its head, but also observe staff members, how we handle patients, ask questions, positioning on how we hold them, but also what kind of materials we use. Do we use towels, just a glove? Sometimes our raptors get a hood on their head to reduce their stress. So just observe us for a little while. And always keep in mind to decrease stress levels for wildlife. Back to the point of the cortisol levels. Cortisol levels are elevated when a wild patient is stressed. So we want to make sure that those cortisol levels are as low as possible. Some important points: identify the animal's defense mechanism. There's always a first and a secondary defense mechanism for every wild animal. So as you can see in the image on the bottom right, the anhinga has a very pointy beak. His first defense mechanism is always to jab with his beak. It is a very, very strong, very pointy beak. It has been known to penetrate different staff and volunteer members here who have not taken the proper precautions. So make sure that you always observe the animal and its defense mechanism. The second defense mechanism for an anhinga is after it tries to strike with the beak and misses, is to always attack with its feet. They have very sharp nails, and that they try to scratch you and kind of push off of you, in the same way a lot of cats play. The screech owl that you see on your screen in the middle, same thing. He has a sharp beak, but his beak is a secondary defense mechanism. He will go primarily with his talons. They will fly down at you. They will strike you with their talons first, get on their backs, on their tails, and strike you with their talons. So that is the first thing that you are going to grab when you are going to grab a screech owl, or any raptor for that matter, is the talons, and then secondary it will be the head. Versus an anhinga, we will start with the head, and then the secondary thing you will hold on to is the feet. For a Muscovy duck or any ducks, the Muscovies are the larger of the ducks. If you are either doing a rescue or aiding in the treatment and exam of a Muscovy duck, the primary defense mechanism for a Muscovy duck, even though they have sharp beaks or sharp nails on their feet, their primary defense mechanism is their wings. They will smack you with their wings, so it's called a wing smack. And males particularly have a hook at the end of their wings, and that hook is actually very, very sharp and can definitely cut you. So we're gonna hold on to the wings first, and secondary will be the feet. And finally, the Virginia opossum, one of our favorite animals here at the South Florida Wildlife Center. They will posture and show you their teeth first. That is their first defense mechanism, is to show you those teeth. And as much as they would like to not have to do anything about it past that point, they will bite if needed. So what you're going to do when you're restraining a Virginia opossum, either for rescue or for treatment, is to restrain its head first. So we're going to go over different techniques for restraining wild patients. And we're going to start off with birds, and particularly songbirds. When it comes to holding songbirds, small ducklings, warblers, these small kind of hand-sized birds, what we are going to do is follow the peace grip. So it's the same exact way when you do a peace symbol. Your two fingers, your index and middle finger, will go around the neck, as you see in the photos in front of you. And the thumb and the pinky are going to restrain the legs. If the bird is fairly large, maybe your pinkies don't meet, your pinky and your thumb don't meet, and they stay on the outside. But this, what it does is the two fingers around the neck will stabilize the bird, and the thumb and the pinky will stabilize the wings. This way the bird cannot fly away, can't get injured. It's important to know that a proper restraint of wildlife is not only beneficial to you, but it is beneficial to the animal. They are not going to struggle and hurt themselves to get away. And what I mean by this is, if you are not to properly hold a warbler, you were to hold it too loosely, it can fly away, and because it's disoriented, fly into a window, a wall, things like that, and become further injured. So you want to make sure you're restraining well. But with birds, particularly songbirds, they have to move their chest to breathe. Their diaphragm is the movement of their diaphragm is what causes respiration. So they cannot have, you cannot hold them too tight. So it's a strong enough hold to restrain them so that they don't fly away, but there should be a little wiggle within your hand with them, so that they are able to move their chest to breathe. It is a fine little distinctive difference between that, but you'll get it, kind of how you would hold a delicate fruit. Adult ducks, whether they be Muscovy ducks, mottled ducks, mallard ducks, they're kind of all held the same way. You can either restrain them using a towel. So you throw the towel over their head and you kind of just encompass them all with this towel. But what you are going to do is you are going to restrain the back end of their wings, not the feathers, the wing, the physical bone structure of the body, so the wings, with the upper thigh, as you see that in the image in the bottom right. That is a great way to be able to restrain an animal to receive treatments, to place bands, things like that, to view a wound. This way the animal is not hurting themselves by struggling. You and the medical team have full view of any injuries, any wounds that need treatment. But if you are trying to weigh a patient or just move a patient from one area to the next, you can see the towel wrap in the image in the bottom left is a good example of what you can do. You can place the duck in there, and then kind of like a burrito, you just fold it over one end and the other, and the duck can't struggle out of it. And at that end, you can move them around. When it comes to handling small raptors, we touched on this a little bit earlier. You are going to wear protective gloves for small raptors like owls, kestrels, small owls like eastern screech owls, burrowing owls, kestrels, merlins, things like that. A thin leather glove, like a gardening glove, is perfect. You can still very easily move around your fingers, especially if it's in a broken-in glove. And you are going to restrain the feet. You're going to use your index and your middle finger in between of the feet of the owl, the small raptor. You're going to put your fingers there, and you're going to squeeze your 3 fingers together. The legs of the raptors will be now restrained, and now with your other hand, you can place it behind the neck under the jawline. This way you have full control of the patient. Their wings are tucked in with your hand. You can move them into a box to weigh them. You can move them into a small carrier to bring them to the South Florida Wildlife Center for treatment, things like that. It's also a great way for a doctor to do an exam on them and treatments. For these guys, you can use any sort of a substrate on the bottom of a carrier. So you can use a towel, a washcloth, newspaper, things like that. When it comes to restraining pelicans and seabirds, it's important to know your species. And if you are unsure if this is your first time handling a species, just ask, do they have nares? Do they have breathing holes? When it comes to some of our seabirds, shorebirds, their nose are only open when they are juvenile, when they're young. As they grow up, as they mature, their nostrils, they will seal. And the most common patient that has this situation is the brown pelican. As you see in the images below, what we always do, and it is common practice, is you put your finger in between of the top and lower beak, and then you keep your finger there. You restrain the beak that way. This way the bird is still able to breathe. You have control of the head, and the animal is not going to hurt themselves nor you. As you can see, the defense mechanism of the pelican in this photo, you can see it real well. It has a hooked beak at the end. You can see that little hook at the end. It is a very hard, very sharp beak. And that hook there is definitely their first defense mechanism, where they will snap at you and bite you. So you're going to restrain that head first. And then secondary, you are going to restrain the wings. And it's going to be kind of a football tuck under your wing, under your arm. You're going to hold one wing, and you're going to scoop the bird like a football with your other hand. So one hand for the beak, the other hand is to scoop the body and tuck them under your arm. Okay, when it comes to other shorebirds, you're going to hold them kind of the same way that you hold them a scurvy duck. You are going to restrain the head and the lower wings with the upper thighs. This is a great way to do a dawn bath, to administer fluids or treatment. You can see the 2 birds in the images are very polar opposite size. The royal tern is about 100 are, 300 grams, whereas the northern gannet in the other photo is about 3 kilos for that one particularly. The royal tern, you don't need anything more than a washcloth and some gloves, some basic latex gloves, whereas the northern gannet has a very strong and powerful beak. You would definitely need some thick leather gloves to protect yourself. They definitely have a very powerful bite. You want to always make sure when you are handling shorebirds, seabirds, any birds that come into contact with water regularly for feedings, you want to always make sure to be wearing gloves, latex or nitrile gloves. The only reason you do not see gloves in the picture with the royal tern is because that tern is getting a dawn bath. It is the one exception to the glove rule. Now, when it comes to restraining mammals, for young opossums, you will use the same technique as you do for songbirds, the peace grip again. Your 2 fingers are going to be around the neck, and with the other hand, you are going to support the body. They can go on any substrate, a towel, newspaper cloth, pillowcase. Just know that these guys, when they are nervous about where they are, if you're doing any rescues, it's always best to not only cover the outside of the carrier, but to also give them something to hide inside. This provides them a little bit more comfort. It kind of feels like they're more in a pouch situation. When it comes to adult opossums, you want to start off with placing a towel over their head. This reduces obviously their vision of what's going to happen, but it also calms them down. You are going to place one hand behind the head along the lower jawline, and you're going to provide a grip. You are not going to close your fingers. You're just going to grip. You're going to close your grip. And this stabilizes the head. Now you have control of that head, and the patient can't turn around and bite you if you are controlling the head. Then, if it is not a female with babies, you're going to scoop under the abdomen, and you are going to carry them that way. One hand behind the neck and one hand under the abdomen. You want to always make sure that you never pick up an opossum by the tail. They do not have prehensile tails like the possum of Australia. Our opossums here do not have prehensile tails, so they cannot hang by their tails. It would be very painful to an opossum to be picked up by its tail. When it comes to a full-grown adult opossum, particularly this time of year during mating season, they are very feisty, and a female with babies in her pouch can be extremely aggressive. So even though they are plain possum, it is always best to wear thick leather gloves. They can be very quick. You want to, once again, support the patient. So you're going to restrain them by holding the back of the neck. But if it's a female opossum, your second hand will go under the front arms, as you see in the photo on your bottom right, and not over the pouch. So you want to make sure one hand behind the neck and one on the forward arms. When you're restraining a large adult opossum for treatments, you want to make sure that that grip behind the head is still there, and you are going to hold the head with that grip. With your second hand, you're going to be right above the pelvis, the hips, and you are going to apply a gentle pressure. When you are holding an animal this way, you have control of the animal. They cannot move. You are not going to be squeezing them down, just a gentle restraint. Kind of if you were trying to make sure that a slippery water balloon was not going to fall out of your hands. You don't want to be too tight, it'll just pop out. You don't want to be too loose, it'll just slip out of your hands. Now, when it comes to squirrels, they are very different depending on what age and size they are. When it comes to a baby or infant squirrel, they do not yet have their teeth. They have not grown in yet, so just your basic glove, latex or nitrile glove is best. You could use a little washcloth to keep them warm. Whatever substrate you put them on in a box is perfectly fine as long as you keep them warm. They do get hypothermic if they are orphaned and you are transporting them here, so make sure you always keep them warm. When it comes to an immature squirrel, and you can tell the difference, quick tell of the difference between a baby squirrel and an immature squirrel is the tail. As you see down below, the baby infant squirrel has a very smooth kind of velvety tail, whereas the immature squirrel has starting to get that bushy characteristic tail of a squirrel. Here you can use anything from a pillowcase, a washcloth, and you would do the same piece grip behind the head and support them with the other hand. So you'd support their bottom with the other hand. These immature squirrels can be quite nippy. They do not bite hard for the most part like an adult squirrel, but they can be nippy. When it comes to adult squirrels, it's good to be mindful and to be concerned about a bite, particularly with a healthy squirrel. They are very fast and very nimble. The best thing to do to restrain an adult squirrel is to first place a towel, a washcloth over the head and body of the squirrel. This disorients the squirrel. And then with thick leather gloves, you are going to place one hand behind the head and you are going to hold firmly and support the bottom of the squirrel with the other hand. When it comes to any support feedings or things like that, you want to make sure that the squirrel is in a contained room. They are quite small and the thick leather gloves can sometimes make it hard for you to hold on to them. When it comes to holding and then back to squirrels, when you are transporting an adult squirrel, you never want to use a cardboard box unless it is a very debilitated squirrel. When it comes to squirrels, transporting them is always best to use a thick plastic carrier container. They do chew out carriers and containers very easily, so we advise that a squirrel not stay in a carrier for over an hour, or else they will chew their way out. And that is the only patient that we give that advice to. When it comes to carrying a turtle, either aquatic or land, you want to make sure that you hold it kind of like you were eating a sandwich. Your hands are going to be placed between the front limbs and the back. For the most part, for land turtles, you don't often have to worry about biting. Even if they are wild, they tend to be, the species we get here tend to be very docile. But when it comes to aquatic turtles like soft shells, alligator snapping, and even sometimes our different slider turtles, you want to make sure that you take a lot of precaution. Soft shell turtles and alligator snapping turtles have very long necks, longer than you expect, and they can reach all the way back to almost their tail to bite. So we advise to kind of just, if you're going to be rescuing one of them and they have a fractured carapace, you want to slide them onto a board. As you see here, the biggest injury, the most pain that is caused to a tortoise or turtle is the friction of the fracture lines. So wherever the broken shell is, when that touches and moves, that's where the pain comes from. So the best way to reduce the pain for a turtle is to have them supported from underneath over a board. You can put a container over them so that they don't run away, cover them with a towel, but it's always best to slide a board under them, as you see in the photo. Okay, so does anybody have any questions? You can unmute your mic or ask in the chat. No questions? Okay, well, I hope everybody enjoy that. And if you do have any questions and you'd prefer to ask me privately, you are more than welcome to email me or stop by my office. Thank you.